Welcome back, everybody. Let's say hello to our friend, Mr. Jon Baptiste. John, can you believe this day?
Wow, we are really seeing an unprecedented time. 2020 is taking the cake. I've never seen anything like this before.
John, will you join me in saying a prayer for the President of the United States and the First Lady?
Oh, absolutely. Pray for their health and hope they overcome this.
Right, because regardless how you feel about Donald Trump, and I have not been vague about that, it is important to see the humanity of this moment and how important it is for our country for the president to be healthy.
Absolutely. Suffering is the great equalizer, and the ramifications of this are major, so we pray for the best.
Jon Baptiste, everybody. Thank you, John.
Absolutely. Thank you, Stephen.
My first guest tonight is a professor of medicine at New York University and physician at NYU Langone and chief medical correspondent for CBS News, here to break down the latest news out of the White House. Please welcome back to A Late Show, Dr. Jon LaPook. Dr. LaPook, thanks for being here today. I know how busy you must be.
I'm happy to be here, Stephen. Thanks for inviting me.
Well, it is truly troubling to see the president taken off to the hospital.
What a sobering moment in time, Stephen. It really is, and it was upsetting to see the President of the United States with COVID-19, and especially, I was in the COVID wards in April at NYU Langone, where I'm a professor, and I know that people the first week, they can be quite stable, but then in that second week, they can take a turn for the worse, and I suspect that's why they want him under close observation at the medical center there.
Well, obviously, we're hoping for the President and the First Lady to fully recover. Now that he is at Walter Reed, what do we know about the severity of his condition, if anything?
We've heard that, he has some mild symptoms and a low-grade fever. We don't know what a low-grade fever is exactly.
That was my first question. What does it mean to have a low-grade fever?
Right. Well, we know that fever, cough, the danger one is shortness of breath. But, we saw him for a few seconds talking. He gave a tweet, a video tweet, and he looked to me like he did not have shortness of breath, like he did not have labored breathing. And then he walked up the staircase to the helicopter, and he gave the banister or the rail about three quick taps. So that was sort of a good sign. But, he is over 65, right? He's 74, which is a risk factor. He's obese technically by the last numbers we have. And in the United States, mortality from COVID-19 in people over the age of 65 is 15%, 15%. So, the odds are statistically that he should get better, especially he's under such close observation and care. But the one thing that's predictable about coronavirus is that it's unpredictable.
The president's physician has said he's receiving something called a polyclonal antibody cocktail as treatment. What is that for the layman?
I think that was a misstatement by them. It's monoclonal antibodies. This is Regeneron's monoclonal antibody cocktail. And you and I talked last time about antibodies, that if somebody has an infection, they have all of these antibodies in their bloodstream, and that's called convalescent plasma. But in that convalescent plasma, there are a lot of different antibodies to different parts of the coronavirus that maybe don't attack it that well, or to other things, other organisms in your body. But the monoclonal antibody it's an experimental treatment. I should say that. It has not been proven to be safe or effective, but it's a technological tour de force in the lab. They make these antibodies that are just directed solely to the part of the coronavirus, that crown. It's called a coronavirus because of the crown. It just attaches to that part of the crown which is necessary for the virus to attack you. So it's a very specific treatment. There is some preliminary data that it does look like it's safe. It might be effective. But again, we don't know enough about his condition to know what was the risk-benefit decision there. Why did they make that decision? Was it just in, quote-unquote, an abundance of caution? But it's an experimental treatment. We're not giving everybody. We do need to have more transparency, I think.
We have so little transparency about the president's health in general, don't we? We know that he went to Walter Reed in 2018 or early 19?
Last year, yeah.
Last year, and we still haven't gotten a really good answer as to why that happened. So do we at this moment really know what the president's comorbidities may be?
We don't know everything for sure, and this brings up the whole point of transparency. One of the very first rules of public health crisis management, Stephen, is to be transparent, to just tell the truth, the whole truth, and nothing but the truth. And paradoxically, if you're honest with people, if you level with them and they know that you're leveling with them, even if the news is worrisome, the whole process is in and of itself reassuring. So you've just got to just tell it as it is. People are grown-ups in the United States. Well, a lot of people are, especially the grown-ups. But I think you gotta be honest with people and just tell them the facts.
Well, the debate on Tuesday was at Case Western and Cleveland Clinic, and the Cleveland officials say they're presently aware of 11 positive cases related to the setup and the planning of Tuesday's debate. Biden and Dr. Biden, Jill Biden, tested negative today. Are they in the clear? I mean, is there a chance that we just don't know yet?
I love that question. The quick answer is they are not in the clear yet. We don't know yet. And remember last time we spent all that time with explaining the biggest misconception of the pandemic, in my experience, has been the 2 to 14-day incubation period. And it's very, very, very relevant right here. So let's go over it again. If I get infected today, I can be infectious, able to infect somebody else anywhere from 2 to 14 days later. That means I could get tested day 3, be negative, day 4, be negative, day 5, be negative, anywhere up to day 14, and at any moment I could go from testing negative to testing positive and then infecting somebody else even without symptoms. That's why it's so important that anybody who is in close contact with anybody who's infected, that they get tested to make sure that to see if they maybe spread it to somebody else, and that they go into quarantine.
So that quarantine, would that include the people that have been in contact with not only with Hope Hicks, but the president the last few days, Mike Pence, Bill Barr, Alex Azar? Should those people, Kayleigh McEnany, should they be in quarantine right now, regardless of their tests?
It depends on whether they were felt to be in close contact, and that's up for sort of a little bit of judgment call. Supposedly it means within 6 feet for 15 minutes. There's no strict rule about that. But if they were in close contact, then they really should be tested to see if they could potentially be infecting somebody else, and then they should go into quarantine. There's confusion about those terms. If you're infected, you go into isolation. If you are exposed to somebody who's infected, you go into quarantine.
Okay. Well, as a doctor, I'm sure you've had a lot of patients over the years who do not take your instructions.
A couple.
And a lot of Americans aren't taking masks or social distancing seriously. Do you think that this might be an opportunity to depoliticize the teaching over how to keep COVID from spreading here, to take masks away from left, right, Republican, Democrat, and just make it the right prescription?
You know, Stephen, I do think it's a potential teaching moment. Clearly masks, and whether you wear them or not, has been politicized for whatever reason. It's very clear that we've had mixed messages on it. It's also very clear that masks are part of the armamentarium that we have to help protect us. Nothing's 100%. So you wear masks, you wash your hands, you have the physical distancing, you try to be in a place where there's not that many dense people. Outdoors is safer than indoors. If you're indoors, open a window, crack a door, have better ventilation, maybe an air purifier. All of these things work in concert together. So not one thing, even the vaccine when it comes, is not going to be 100% effective. So you've got to do all of these things together.
Doctor, we have to take a quick break, but stick around, everybody. When we come back, I will ask Dr. LaPook about whether the president should do the next debate. Stick around.